Uh, Good evening, everybody, and welcome to the community-based education session. I would like first to begin to introduce us to each other. Every one of you will introduce him or herself and answer the one of the questions that was posted on the model. If he or she is coming from a community-oriented or community-based education, or none of the above. And if it's none of the above, just to tell us how he or she would define his or her curriculum. Okay? Yeah, and Ms. Hikmat will help us introduce ourselves one by one. Ms. Hikmat?
مع حضرتك دكتور أماني.
Yes, Assalamu alaikum, everyone. I'm working in emergency department in Emirates, and actually I was reading about community-oriented and community-based and what is the difference. And I think I put in my reflection also that in certain time we practice community-oriented program. As an emergency, we suppose we are a bit away from academic teaching and preparing academic titles and teaching the students and the colleagues. But in a way, when we are facing some problem in the community around us, we are thinking about doing something. So our work is mainly community-oriented program. We are arranging some sort of programs related to this problem in the community. And after this, we are going to the community around us and start teaching people. So we are depending mainly on the needs first from the community around us. Then we are creating a program. Then we are implementing this to go outside again to community. But mainly for the program, we are teaching people who will go outside inside our hospital first. So teaching.
Thank you, Amani. And please allow me to call you by first name, because as you all know, at FAMR, we all leave our titles at the outdoor. Thank you very much. What you said is very informative. We will see if what you described is really under the title of community-oriented or community-based or none of them. Thank you. Okay, next, please. Next. Hikmat. Can you hear me?
سامعني يا دكتور؟
أيوة سامع. why you didn't call next one? خليكي معايا لو سمحتي على طول يعني.
مع حضرتك دكتور نون.
Assalamu alaikum, everyone. This is me, Noon. I'm a clinical pharmacist. I'm working currently at the Sudan Medical Specialization Ward. I do believe that
And where are you from originally?
From Sudan.
From Sudan.
Yeah.
And working in Sudan.
And working in Sudan.
Good.
So, regarding the first question, yes, I believe that our institute follow a community-based education because in the recent years, we have shifted the curriculum from the traditional one to a community-based curriculum that ensuring both training and research as well as service are directly engaged to the community services.
And
So
what is the name of your institution in Sudan?
Sudan Medical Specialization Board.
Okay. Is it in
Yes.
Khartoum?
It's located in Khartoum, but now because of the war situation, Khartoum is still under the war. It's not in Khartoum anymore. We displaced to many places around
Okay.
Sudan and around the world. Yeah.
Right.
So
Right.
yeah,
Thank you.
that's why. You're welcome.
Okay. Next, please.
أميرة الأنصاري. دكتور أميرة الأنصاري.
Amira, where are you? Unmute yourself.
دكتور مروة صلاح.
Good evening. I am Marwa Salah. I am a lecturer of orthodontics, Faculty of Dentistry at Shams University. I believe that my school is not adopting a community-based education system, but it's working a lot within the community through serving unserved patients, helping and giving experience to experts and the Ministry of Health, sending conveys to rural areas. So I think it's a little bit community oriented.
Okay. Thank you. Thank you, Mara.
دكتور شيماء محمد.
Good evening. I'm شيماء محمد عبد الستار or شيماء محمد أبو السادات.
أي حاجة يا دكتور.
Okay. So
تمام.
I'm شيماء أبو السادات, Associate Professor of Oral Maxillofacial Radiology, Faculty of Dentistry. So it's the same as Marwa said. We're not community-based. We're not community-based, but we serve the community, like the medical convoys, and sending or collaborating with the Ministry of Health, and that's it. So we're not community-based. Our institute is not community-based.
Shaima, you said you're from the Faculty of Dentistry, but you
Yes.
didn't tell us which university.
Ain Shams University.
Okay. Okay. Thank you.
Thank you so much.
Next, please.
دكتور جمال.
Hello everyone. Gamal Abdel Qadir, originally from Egypt, but now I am a lecturer of microbiology and immunology in Jordan at Faculty of Dentistry, Petra University. The main discipline is medicine, but now I work in dental school. As my colleagues say, dental school usually teach student case-based scenarios and health trend and oral health challenge in community, but without a community outreach. So I think it is a community oriented education.
Okay. Thank you.
Thank you, Doctor.
Thank you, Gamal. Next, please. Hikmat, how many fellows we have in this batch? Hikmat. Okay. Who wanna go?
دينا نبيه.
Okay.
Okay, good evening. I'm Dina Nabi, Professor of Public Health originally from Ain Shams University, and currently Head of Department of Public Health, as well as Vice Dean of Community Service at the School of Medicine, Ugiza University. So talking about School of Medicine, Ugiza University, I believe that we are mainly a community-oriented education because we do not fit to the classification of community-based education that it has more than 30% of activities done in the community.
May I stop you here?
Yes.
Do you think that those who don't fit into community-based education, they are by default community-oriented?
No, not necessarily, but we are community-oriented since our students since year one goes to many NGOs for different areas, and they interact with them and work with them. They go to primary health care centers since year one. They have, and all these activities are curricular activities. They go to the community and do awareness at the community hospital and at schools as part of their year 4 curriculum during the family and community and public health, in addition to research and surveys, and all these are curricular. This in addition, of course, to other extracurricular.
Thank you, Gina.
Thank you.
In which group you are of the 5 group?
Group 3.
Group 3. So you will learn from group 1 the difference between community-oriented and community-based education. We are all going to learn from each other.
Sure.
Right? We are
Looking
going to teach each other and learn from each other.
Sure.
Because your definition of community-oriented education is not very accurate. Okay? Thank you very much.
Thank you.
Thank you. Next, please.
Dr. Sam.
Hello all, Dr. Rabi. I am Salima, lecturer of anesthesia at Ain Shams University. I think I can speak about my department. I guess we are not either community-oriented or community-based education.
In this case, if you are not community-oriented or community-based, how you define then your curriculum?
It is, I don't know the expression to define.
Okay.
But it is down in the ladder of community involvement, because actually we don't have any community reach, in my opinion.
So you don't have any relation with your community?
No.
No. Okay. Which school is this in Ain Shams?
Ain Shams, yes.
Yeah, faculty of what? Faculty of medicine or dentistry or pharmacy?
Medicine.
Medicine, okay.
Medicine, but anesthesia department, and I know how it is difficult to be community-oriented in anesthesia department, but it is
and in which department you are?
Anesthesia and intensive care.
Anesthesia, okay. Thank you so much. Thank you. Okay. Please unmute your microphone.
I didn't hear well. Did she name Ahmed Samir? Me?
You can go. You can go.
Okay. Assalamu alaikum, everyone.
Alaikum salam.
Okay. Okay. I'm Ahmed Samir. I'm lecturer of histology in Ain Shams Medical School. I'm also director of the e-learning center. So regarding our medical school, I guess it's community-oriented, not community-based. Yes, there is some field visits done by students in the community medicine, but I don't think that curriculum and the assessment is reshaping the education part and the assessment of the curriculum. So I guess it's community-oriented, not community-based.
So Ahmed, you contradict what Wissam just said. because Wissam is from the same school, and she said that the Faculty of Medicine in Shamsi University is neither community-oriented or community-based. So, are you sure you want to contradict what she said?
Yeah,
You know, I hear here I play devil. I play devil advocate. We will see who is right by the end of this session. No problem. Next, please.
دكتور رندا.
Hello, everyone. Hello, Dr. Wagdi. I'm from Faculty of Medicine as well and Shams University, so I I will
well, we needed a third opinion.
Yes,
انت اللي
so we
هترتبي
needed-
العملية بقى في الآخر.
Yes, I'm associate professor of ophthalmology and I'm the teaching coordinator of my department. I think that in our faculty we are community-oriented education. We have community-oriented education because we see the needs of the community and we try to cover this in our curriculum. This is a point, and the other point that the students start to make awareness for. We have activities in our department and the EMP section. They did activities many times to raise the awareness of the community or the population about certain ophthalmological diseases. And as well, we send medical convoys to rural areas. So I think that we are community-oriented. We have community-oriented education. I agree with Dr. Ahmed Samir.
Okay. So you say that you are community-oriented, right?
Yeah, I think so. Yeah, I think so.
Okay. No problem.
So
Next, please.
Good evening, everybody. I'm Dr. Somati, and I am an associate professor from the Department of Community Medicine. I am from MNR Medical College and Hospital, India, and I can say that the medical curriculum in India is followed same all throughout. And our educational approach is both a little bit towards community-oriented as well as community-based medical education. I am saying this because as community-oriented, we actually we do the health need assessments and we train our students accordingly. And we do focus need-based, our focus is need-based. And we train promotive and curative healthcare. And I am saying even our students are coming, I have trained under community-based medical education. The curriculum that we have adopted recently from 2019 is competency-based medical education. And in this competency-based medical education, our students are directly involved into the communities as part of training right from their first year. And this will be continuing till they finish their internships. So they are exposed to rural health and they adopt families and they are also, after they finish their graduation also, they are supposed to definitely do their training in rural health centers during the internship for 2 months or so. It is a mandatory service also. So I can say that it is a bit of both community-oriented as well as community-based medical education.
Excellent. Thank you so much.
Thank you. Thank you.
Dr.
Next,
Amal.
please. عليكم السلام.
I'm Amal Mahfouz, Associate Professor of Pharmacology and Toxicology at Egyptian Drug Authority and at Modern University, previous in School of Pharmacy and now in School of Nursing.
Which university is that?
Modern University.
Modern University. Okay.
I think it's a curriculum community-based, community-oriented and community-based. Community-oriented as the curriculum is designed to make the graduates meet the community health needs. and it's community-based as the graduates are required to do many trainings in the hospital or in the pharmacy, in the community pharmacy. So it's community-based and community-oriented.
So when you send your students to be trained in the hospital, do you call this community-based education?
I think the training in the community hospitals or clinics or pharmacy, I think it's community-based.
Okay, you are from the Faculty of Pharmacy, right?
Yes, pharmacy, Ain Shams University.
Okay, Ain Shams University. And which group you belong?
Group 2.
Group 2, okay. Again, you will learn from group 1 the difference and definitions of community-oriented and community-based education. But thank you very much, Amal. Okay. Next, please.
سلوى دكتور سلوى.
Salwa, unmute your microphone, please.
Somebody in my group she will present, but I can present. I am a community health nursing. My specialty. You hear me, Dr. Hani?
I'm Dr.
Hani?
Wagdi.
Dr. Wagdi, you hear me?
Yes, I can hear you.
Yeah, I have my university in Egypt, and now I'm affiliated with the private university. Both of them community-based approach. We depend about serving community in a lot of community activity, and we have a lot of partnership affiliation with the community setting. Like we're doing wellness program for student and wellness program for community. We're doing smoking cessation program. We're doing breastfeeding program. We're doing a lot of health education program to serving the community. School health, primary health care, and in-home health care.
Okay, Salwa, does this mean that your school is community-based but not community-oriented?
Both of them.
Both of them.
Like we did community analysis survey in primary health care. We survey patient to know the need for the patient, especially because the patient coming to primary health care. One of the needs they define that they need health education about a lot of things like
you identify the health needs, but you reflect from such health needs on your curriculum?
Yes. One of major objective in our curriculum, community-based oriented, and this was one of the major goal, and we break it down and in terms of specific objective and the KPI.
Okay.
And we have rubric in place to measure student engagement in the community.
Thank you, Salu. Next, please.
Dr. Kojbu.
Unmute yourself, please.
I'm Dr. Khushbu Goyal. I'm working as a consultant periodontist at the Institute of Medicine, Maharajganj in Kathmandu, Nepal. Our curriculum still needs to be updated. So we follow the SPICES model. So we're still going in a revision for competency based, but we're still following. So it's more of community oriented. It's not community based completely, our curriculum. So there's only on-field visits of students in first year and third year and fourth year. So, but it's not community based completely.
From what I heard from you, I think you think that community oriented and community based is like a continuum. It starts by community oriented, and when you increase the dose, by the end it becomes a community based. Is this how you think about community oriented and community based?
No, sir, not really.
Okay.
Not really.
So then you say that you think you are community oriented,
Sir. Yes, sir. We are
right? But
yes,
not
sir.
community based.
Based. Yes, sir.
Okay.
Institute-
But you intend to become community based.
Community based. Yes, sir.
Is this a national trend in India?
In Nepal, sir. So I'm from
In
Nepal.
Nepal, sorry,
Yes, sir.
sorry.
So it's not a national trend here. So there's no university which is completely community based here in Nepal.
In Nepal.
Yes, sir.
Okay. Are you in Kathmandu or where in Nepal?
In Kathmandu.
In Kathmandu. Okay.
City.
Very good. Thank you very much.
Thank you, sir.
Next, please.
دكتور أحمد خلوصي.
السلام عليكم.
عليكم السلام.
I'm Ahmed Al-Kharousi from Oman, working as assistant professor in University of Nizwa, Faculty of Physical Therapy. So I think in university, because we have one of the pillars that we depend, it's more of community service across all the programs. And within College of Health Sciences, we have some parts, components where actually we deliver like intensive programs to the community. Like, for example, we tackle issues related to geriatrics, issues with disability. So our students are trained and they go to the community and they train, for example, the parents or those who are actually caregivers, how to deal with some certain issues. But I will call it's more of blended. It's not like all the program is community based.
Okay, thank you very much, Ahmed. Next, please.
دكتور شيماء.
The second Shaima in this batch, right?
Yes,
دكتور شيماء عبد الستار.
yes, I am Shaima Abdel Sattar, professor of radiology at Ain Shams University. Community-based and community-oriented education are closely related. I think our school is community-oriented, and it's much observed during COVID pandemic, as our university hospitals worked efficiently to face this pandemic. And regarding our radiology department, we arranged online webinars to orient the radiologists about the imaging findings of the COVID disease in the chest and the other systems. Also, we have a tropical medicine department offers postgraduate studies and the fair share in undergraduate education. Also, our school also shared in the 100 million health mission adopted by the Ministry of Health and with frequent convoys to rural areas. The curriculum contains a significant part about the diseases in our community. Field visits are not included as a component of undergraduate education. Our school may be not fulfilling the criteria of community-based education with CBU domains, all domains to be socially accountable. I think our community, our hospital are maybe socially responsive and socially responsible, but not all the criteria of social accountability. As I read your book, Dr. Wagdi, about community-based education, and I saw many images from students in the medical school engaged in the community with field visits. Also, the training the individuals in the community to face emergency situations. Also, the members of the community is engaged in the assessment and in the educational process of the students. So I think this may be not fully community based. However, it may be community oriented.
Thank you so much, Shaima. Excellent description of your program. Next, please. Hikmat, we didn't hear you. Abir.
Hi, Abir Abdel Mohsen, professor of histology at Shams University. And I think we are a community-oriented education faculty.
Okay.
Thank you.
Thank you so much. It seems that and Shams is community-oriented but not community-based. 6 till now have spelled that very clearly. Thank you. Thank you, Abir. Next, please.
Dr. Amira.
Who?
Okay, I am Dr.
Dr.
Amira
Amira.
Abdelkarim. I am lecturer of public health and community medicine at Tanta Faculty of Medicine. Regarding our institution,
Which university?
Tanta Faculty of
Tanta.
Medicine.
Tanta, okay.
Okay. And our organization can be described as both community-oriented and community-based. Regarding the community-oriented curriculum, like we address we have the approach, which is like taking into consideration the community-oriented education. Regarding the community-based, we have a practical part that's the practice in primary healthcare units. Students are engaged with the community through.
You must be from group 1, right?
I'm not from group 1. I'm from group 4.
يبقى غشيتي من. تمام.
No.
Okay.
Maybe like my department, sub-department is community medicine. That's why.
That's why.
So, this is my specialty. I'm lecturer of public health and community medicine. In our department, we have training, practical training inside the primary healthcare facilities. Students are required to provide health educations, and they are engaged with community. And we have a checklist and observation for skills they acquire inside the primary healthcare settings. So I can describe. To wrap up, I can describe our organization as mixed community-oriented and community-based education.
And
Thank you.
run all these activities just by the community medicine department or by the whole school in an integrated way?
It's not all the departments, but previously it was only as a part of community medicine only, but as a new curriculum we moved to integrated competence-based education and integrated modules, so the community-based education increased.
But you know that community-based education is the top level according to Hardin's integration scale, right?
Exactly.
Okay, and he called it transdisciplinary integration between all departments, right? Do you know what level is that? Number what?
Which level in our organization, or generally speaking?
Community-based education goes up to what level, which is called transdisciplinary integration?
No,
level
I don't
11.
know.
Level 11. Okay. Next, please. Angie.
خلاص كده يا دكتور فينيش مفيش حد
خلاص
تاني.
finished. Okay, so thank you very much for this interaction between all of us. Now I know you all, and we will now start the Jigsaw group learning, and we will start by group 1 and listen to some instructions before we start. Every group will show us a very nice skill, which is how to summarize their presentation in 5 minutes, because I believe very much in a statement which says less is more. So please try to be very concise. Do the presentation just in 5 minutes and leave 5 minutes for the questions of the other groups. Okay? Group 1, please.
I hope the
Could you put it in the slideshow mode? Yeah, right. Okay.
yes, I hope it is visible. Yes, so we will be discussing community-based education by grouping a team of four
Listen,
members. Yes,
so Mithri,
yes, sir.
could you raise up your voice, please? Speak a little louder, please.
Yes,
Or
sir.
come closer to the microphone.
Yes,
Yes.
sir. I hope I'm visible now. Sorry, I'm
Okay.
audible now.
Yeah. Okay. Good.
Yes, sir. So I am presenting on behalf of Group 1.
No, we need everyone in the group to take part. But if you were not prepared for that, that's okay. But listen, the beauty of this jigsaw group learning is that each one should be active and involved in the presentation and the discussion. So is it too late now for each one in your group to take part?
Sir, we have actually discussed and we have made the PowerPoint presentation with all of us agreeing with it. And we discussed when we were making the PowerPoint presentations we are okay. We are open to discussion if after the PowerPoint presentation is over, all of us are
Okay.
open to
Okay.
talk or clarify.
But for the other groups, we prefer that you involve all the members in everything, including the presentation itself. But for group 1, just a representative of the group will present. Go ahead.
Sorry, Dr. Wadi, we really asked about this details and they answered on us just
Who
one
answered you?
will present.
Who answered you?
I think Hikmat.
Okay, thank you.
We really misunderstand this issue
No
and
problem.
asked many times, but finally we choose one to present today.
No problem.
Thank
you. But in the syllabus, you couldn't find my WhatsApp or email to ask me?
We used to ask in the group to get a rapid answer,
but you know that's why the syllabus is very important, and we put this information in the syllabus just in case you need to ask questions like this. But no problem. Okay.
Thank you.
Symmetry, please go ahead.
Yes, sir. So we would be discussing community-based education, the emergence in the second half of the last century. So community-based education. Yes. So this has emerged in the second half of the 20th century, and it has emerged because we were moving towards and recognizing the importance of hospital-centric medical education, which actually did not prepare all the doctors to face the real world. Hence, we were moving towards community-based education. That was the main point for the emergence. And why we were actually shifting from the reasons of emergence for CB is focus was primarily on primary healthcare centers, and there were a lot of social determinants of health which were not actually addressed in the community-oriented education. And here we were actually health system needs were not actually focused, and apart from it, even global health movements. All of the medical training was moving towards community-based education. Hence, these were the reasons of CB. Coming to the historical perspective of how the community-based education has started. All this has started when World Health leaders have actually come together in Kazakhstan, and they have recognized that primary healthcare was the most important thing to improve healthcare improve the healthcare of the population, and also they wanted to achieve proper healthcare by the year of 2000. To achieve this, they have actually focused on medical schools. A new curriculum was introduced, wherein they were actually emphasizing on community needs and how they could actually unite all the unity of for health. This is what they were actually focusing on. And then has come the part of community-based medical education as well as community-oriented medical education, which was introduced in Jamaica. And coming to the later part of it, the idea of training the health professionals have started slowly moving towards this phase. And instead of caring for sick and healthy populations, they were also concentrating on health promotions, their sanitations. They were even discussing upon clean water for diseases, etc. So all this was happening around the quarter century, even before the Alma Ata or the network meetings. And over a period of time, around 20 healthcare professional, higher professional education institutes, they have started offering innovative strategies so that all the health professionals, even the physicians, they have involved professionals through the various disciplinaries and in different countries, and they have come to this concept. Of their and they were actually needing. And what were the concepts and rationales and values for the CBE? The concepts to develop CBEs was for community engagement, interdisciplinary collaboration as discussed, primary healthcare focus, and context-specific learning. And rationale was they were trying to address whatever the health gaps were depending upon their country to improve the overall health outcomes as well as to increase the retention in undeserved areas. And what are the values for the CBE? Equity. It means that everybody, whoever is requiring, they should have access to this. And socially responsible, we should be culturally sensitive, empathetic, as well as prevent. And also we are supposed to focus on prevention and holistic care. Now we'll be seeing what is CBE and COE. So in simpler words, CBE is actually nothing but it is experiential learning. Here students are directly engaging and contributing to community projects or challenges. Whereas community-oriented education is we are adapting the educational system, which is more relevant to the community, and it is integrating its issues and needs into the curriculum. Hence the need-based. What is the difference between both of these? Community-based education, it actually has, students are actively participating in this, whereas community-oriented education, it has the curriculum alignment towards it, and the values are there. And approaches for community-based education is students are having hands-on training, and they're directly involved, and their primary objective is to gain practical community work, and this is totally centered towards real-life situations or in whatever is happening in the community. And whereas community-oriented education, it is more of theoretical knowledge and academic knowledge, and they're totally, it is on book-wise. It prepares only theoretically more than practicality, and it does not actually completely involve what is ever is happening in the real world. They are not completely involved. And so we can say that community-based is actually focusing on real world problems and they're directly involved. So that is the key difference. What are the possible determinants of community-oriented education? So the determinants that of the community-oriented education is cultural context, national and local health policies, community-oriented healthcare programs, socio-economic context, and social responsibilities. All these were the main determinants for the development of community-oriented education. Is what we have understood through our learnings and our discussions. So to minimize, it would be nice to actually summarize community-oriented education is going to slowly move forward, and we will be moving towards community-based medical education is what we want for a better future and a holistic healthcare system and communities. Thank you, everybody.
Thank you, Smith. Do you have a reference for the determinants of community-oriented education?
Sir, we have actually searched through AI, and we have searched through some literature. I have not added any kind of reference. We will keep it in mind, and we will add the references next time.
Yeah, because I already have sent you a reference that was just published a couple of months ago in Education for Health, which is the journal of the Network Towards Unity for Health.
Okay, sir.
Its title is Determinants of Community-Oriented Education. And I think that was the first time that such determinants were published in literature. That's why I wonder from where you got these as the determinants of community-oriented education.
Yes, doctor, I am from group 1, Dr. Salwa.
Determinants
And
we have
Mhm.
actually
I
thought
send,
through, sir, because
Let's hear Dr. Salwa, please.
yes, I am from group 1, and in my presentation, I pulled your article exploring the determinant of community-oriented education, relevance, it's a scope review, and the determinant mentions as like you have to be relevant to community need, priority of health problem, level of integration, community involvement and empowerment, cultural sensitivity, social accountability, healthcare science, health system science, collaboration with organization and the government. I read this
So,
article yesterday.
Salwa, in this case, and you're a group together, why you didn't share
I
this?
share my presentation. I share in the group. I put my presentation in the group.
And you didn't see the presentation
No, I did. I sent my.
before
I
it's
asked you the 2
presented?
questions. I was the responsible about this part, and I sent it to all group. Yani,
Okay,
I
okay,
download
no
my
problem.
presentation.
No
Yeah.
problem. No problem.
But with this article, doctor, it's very interesting article, and it's up to date.
Okay, no problem. No problem. Okay, thank you very much. Group 1, let's see if you will have questions from the other groups. And I encourage the other group to ask you because group 1 will ask you in return. So please raise your hand in case you have a question for group 1. From what I see, there is no raised hands. Then I would like myself to ask a group 1. Could anyone other than Symmetry tell us in simple words the difference between community-oriented and community-based education? In simple words, and use your own words, away from the definitions. Anyone but Symmetry and Salo from group 1. Symmetry, how many in okay.
Okay.
Abir,
Yeah,
you're from group 1, right? Okay.
Yes, yeah. I think that the community-based education, it is important to be in direct with the community, and to
You mean you train your students
in the
through
community.
serving the community. You
Yeah.
send them outside the walls
Outside,
of your
yes.
school to be trained within the community,
Yes.
from the community,
Yes,
right?
but oriented education, there will be more theoretical, more in the classroom, and the curriculum be conducted to help the community, but it is more theoretical.
Help the community means that the community service component of the community-oriented based education. But what about the education itself? What do we do in community-oriented education to make the curriculum, for instance, oriented to the community health needs?
To have a curriculum focused on the needs of the community. Focused, yeah.
On the community health needs.
Yes.
And how do you do that in a school very traditional like your school in Ain Shams University?
Yes, to know the problems of the community, and
if
then
you know about the problems and you are discipline based, so what? How could you reflect then on the syllabi? You have different syllabi in the different departments, like 20, 25, 30 syllabi, but you don't have one integrated curriculum to...
Now we have
You
an
do.
integrated.
Now we have, because of the integrated curriculum, right?
Yeah.
So if you are oriented with the community health needs, how then you can reflect on the different syllabi of the different departments?
No, I don't know.
Okay. But at least now
Dr.
you know
Talat,
that...
we can
I'm
implement
sorry?
it as
Salwa.
we can implement it as an elective course. We can elective course, and we can do the focus is community oriented.
Okay. Elective courses is one solution, but it's not the whole solution, you know?
It's one of the solution. Another solution, we can embed it in the part of the clinical, in our clinical courses, like field trips, like of the.
But what if you were having an integrated educational strategy in the first place, like problem-based learning? So everything is around educational problem. You can easily
make
reflect...
a case study.
Right.
I can make a community case study and apply the steps of problem solving technique.
In case you are adopting an integrated educational strategies like problem-based learning, team-based learning, case-based learning, as some of you said, right?
Yeah.
Okay.
Yeah.
Okay. Thank you, Abir. Thank you, Salwa. Thank you, Group
We
1.
appreciate your coach and Dr. Talat.
Thank you, Salwa. Okay. Let's. Shaima is having a question.
Yes.
I'd like to ask Group 1 about the assessment, the difference in the assessment between community-oriented and community-based.
I think the assessment goes to Group 4, right? Yeah. They will answer your question when we get to Group 4. Then Group 2, please.
Assalamu alaikum everyone. This is Minoon from Group 1. We are going to present developing a community-based education for undergraduate. This includes framework, key resources, classification, possible partners, and educational setting. The team also consists of Dr. Ahmed and Dr. Amal. So why do we need community-based education? For enhancing the clinical skills and critical thinking, building community engagement and social responsibility for their students, and to prepare them as well for real-world healthcare challenges, as well as to encourage interprofessional collaboration. So there are 5 main steps in developing a community-based education. First of all is to define the learning objective. Secondly, to identify community needs. Then to develop partnership, creating learning activities such as fieldwork, case studies, and finally, to conclude this with assessing the outcome of this intervention. So we also have required resources to apply and implement the CPE would be human resources such as faculty mentors and preceptors, community health workers, medical students and residents, as well as local government and NGOs. Also, we have the financial resources like funding from universities and grants, government and private sponsorship, and scholarships. We need also to apply this technical support, such as e-learning
Before
platforms.
technical support, if you allow me,
Yeah.
could you include transportation in the financial resources? Because if you adopt community-based education, you have to send your students to the community and secure transportation for them.
Yes,
Isn't that
okay.
financial?
Yeah, it's financial.
Okay. So please
Okay.
include this in your financial resource.
Okay, well noted. Thank you.
You're
For the
welcome.
technical resources, we have the e-learning platform, data collection tools, telemedicine, and AI support. Finally, we have the physical resources. We have it here. Physical resources, we have community clinics and mobile units. We have the simulation lab and also transportation and accommodation for students placed in rural areas.
You know the difference? If you are having your own buses to use it for sending your students to the community, this is a physical resource. But
Yeah.
if you spend money and the students will go on their own to the community and reimburse the costs from you, then this will go to the financial.
Yeah, okay. A clear
Yeah.
difference. Thank you.
Yeah, you're welcome.
So, how could we classify the CPE program? There are three main classification or parts. We can say there is a service-oriented program, research-oriented program, and training-focused program. Then each section has two subsections. For example, for service, we have community development and health intervention. For the research-oriented, we have health facility-based and community-based. And finally, for the training, we have primary care-oriented and community exposure. So how could,
Noon,
yes,
we are all coming from the developing country,
yes,
right?
yes,
So, which one of those do you think will be used more heavily than the other two? Is it the service-oriented programs or research-oriented programs or training-focused programs?
I believe the training.
The training.
Yeah.
And then?
Then the service followed by the research.
Excellent. By the way, the training is used whether you are a developing country or a developed country, right? Because this is the essence of community-based education. But in developing countries, if you don't serve the community, they will not be responsible or even accept your students to be trained within the community. See the difference?
Yeah, completely right.
And the
Yes.
community usually in developing countries needs service because the governmental services are usually lacking in such communities. That's why they would welcome the training of students if you provide service in return. See the significance?
Yeah.
Okay.
Okay, thank you.
You're
So
welcome.
how could CPE program be evaluated? We have main source of evaluation. We can do continuous constructive feedback, observational assessment, peer review, reflection, and report. So here are the partners. There are possible partners for a CPE. Why do we need partners to do so? Because to ensure the sustainability, resource allocation, and effective training environment. The possible partner can include academic institutions such as medical schools, interprofessional education institutions. It can include also government and health ministries such as Ministry of Health and Ministry of Education, and also local health department can facilitate community placement. So other
Wait,
possible part,
wait,
yeah.
wait. In the academic institution,
Yes.
you said medical schools and universities play a central role in designing the curriculum, providing faculty,
Yeah.
and ensuring academic accreditation. So, in the academic institution, where is the major partner in a student-centered education? Because, in community-based education, we call it as well, we call it
Student.
student-centered education, the
Yeah.
same as problem-based learning.
Yeah.
So where are the students here as a partner, as a full partner?
There is a section where the student will be involved. I believe so.
Okay.
Yeah.
So let's see later.
So, healthcare facilities, primary healthcare centers. Also, we have the community hospital and clinics, specialty referral centers. We also have the community organization and NGOs, such as public health NGOs and community-based organization. We also have the international and private sector partners such as WHO, UNICEF, and other global health organizations. We have private hospital healthcare companies, and also we can include the pharmaceutical and medical technology companies. No, it didn't appear. It should appear somewhere. Yeah, it appeared nowhere. Yeah,
Another major partner also does not appear here.
yeah,
Who is the community proper, the community representatives,
yes, yes,
because the NGOs and the whatever you call them as community or organizations, this does not represent the real community. The community
yeah,
that you will really send your students to work with, to learn from. So the community should be a major partner here, as well as the students, right?
yeah, yeah.
Okay.
It's okay.
Yeah.
So, educational setting for CPE. So for CPE programs to be implemented in diverse learning environment, we should provide contextual and experiential learning. These include community health centers and rural clinics. Here the students appear finally. Students interact with an underdeserved population to improve their understanding of social determinant of health. Also, their exposure to primary care challenges, preventive medicine, and resource-limited healthcare delivery. Also, the educational setting include urban and suburban primary care setting to provide exposure to common outpatient cases and chronic disease management. This also enables students to work in interprofessional teams with family physicians, nurses, and social workers. Also, one of the settings which are important, public health and outreach programs like school-based health programs, so to allow the student to engage in child health and monitor and preventive education. Also, mobile health clinics, which offer services in remote areas, combining field work with clinical exposure. Home visits are also important, and elderly care program. I remember in Sudan we had this for home visits, help students understand family dynamic in healthcare. So also we have simulation and telemedicine, one of the most important CPE programs. Simulation Center offer training in emergency response like obstetric care and surgical skills in a controlled environment. Telemedicine platform allows the student to engage in remote consultation and digital health interventions. Finally, we have the interprofessional training hubs, which is a collaborative program with nursing, pharmacy, physiotherapy, and public health students. These encourage also teamwork in managing patient care and community health projects. Whenever we apply CPE, we face some challenges that include lack of funding, limited faculty availability, and resistance to change. There are some solutions we can apply, and you can add more as you like and as you see, like seeking external grants and partnership, provide faculty incentives and training. And before doing anything, we should do a pilot small-scale program before full implementation, so to assess and to know our weaknesses and strengths. In conclusion, we want to say that this setting bridge the gap between classroom learning and real-world medical practice, ensuring that the students are well prepared for patient-centered care in their future careers. Then this is our references from where we got our information. And thank you. We're open for any question.
Thank you, Noon. Any questions from the other groups? Raise your hands, please. No? Okay. Thank you very much, Group 2. Group 3, please. Could you unshare your... okay. Group 3, please. Share your screen.
My screen visible?
Yes.
So we are from Group 3.
Could you put it? Yeah, okay. Okay.
Group 3. And the task that was allocated to us was, one second, was what competencies concerning CBE could be addressed in the curriculum for undergraduate health professional students. One learning objective for each competency, and give an example of community-based learning activity for each objective. So we identified 6 competencies, or let's say 6 themes, which is based on public health, cultural competence, community development and advocacy, leadership and management, research and evidence-based practice, and generic competence like communication, decision-making skills. So I would like to begin one by one, first with public health. So in public health, the competency that the graduate would work as a primary healthcare provider at the primary level. And the ILO we took was take and record a structured patient-centered history. The activity for this competency to be achieved was to visit at the primary healthcare center and take history from patients and present them at the family physician. The second competency was cultural competence. In this, the graduate would act as a professional, and the ILO would be that to treat all the patients equally and avoid stigmatizing any category regardless of their social, cultural, or ethnic backgrounds or their disabilities. And the activity would be field visit to NGOs dealing with HIV patients as one of the example for activity for cultural competence. The third would be community development and advocacy. So the graduate would be also acting as a member of the health team, and the ILOs would be building community partnership and collaboration. And the activity would be field visit, interactions in non-clinical settings, like increasing social engagements with the community health workers and as well as the health stakeholders, the community stakeholders who are there, so that they can know about the social engagements. The fourth would be research and evidence-based practice. The graduate would also be a researcher. The ILOs would be to apply different steps of research, study, and implementation, design tool for data collection and questionnaires and checklist, practice data management using SPSS. The activity would be develop a protocol with a data collection tool and collect data and prepare a report. The next competency would be regarding leadership and management. The graduate would also be acting as learn how to be a good leader. The ILO would be to train community healthcare workers to independently manage health centers. And the activity would be partner with the non-governmental NGOs organization working in healthcare and take on leadership roles in projects to address specific health needs, learning project management and collaboration skills. And lastly would be the generic ones, which will include the communication skills, your decision-making skills, critical thinking, the graduate as a health promoter. The ILO would be to apply different principles of health education for developing effective health education at individual and community levels. The activity would be health education sessions, or let's say a training or a teaching kind of a session at schools from the community areas. So these were the 6 competencies that we identified. So, thank you. We are open for questions. We just made it very short.
Brilliant. Group 3. Excellent. Thank you.
Thank you. Thank you.
Any questions for group 3? Any raised hands? No. Excellent. Okay, group 4, please. Unshare your screen, please. Group 4, would you share your screen, please? Marwa.
Yes.
Um,
Everybody, I hope, can you see my screen?
no, we can't see it yet.
Okay. Just a minute. Is it appearing now?
Not yet.
Not yet, Dr.
Oh, yeah. Okay. Just a minute.
To save time, can we start? Okay. Now it's
Is
appeared.
it appearing?
Yeah.
Okay. Sorry for the delay. My group 4, I'm representing the work of Dr. Ahmed Samir, myself, and Dr. Amira. We have 3 questions regarding our work. The student assessment approaches and tools that match the community-based education, and the role of the community and community representative in this assessment, and the expected challenges during planning and conduction of the assessment in community-based programs. Okay, let's
Remember
start.
when we had a question about student assessment, and I told the one who asked to wait for present.
Yes,
Group 4.
Dr. Shaima
Okay.
Abdel-Sattar, she asked about that.
Right.
Yes.
Here we
Okay.
are.
So the aim of the community-based education is to produce a graduate who are responsive to the health needs of their community. Since it is not a conventional form of education, it requires assessment method different from those used in class learning or in teaching hospitals. There are 8 methods for this assessment. The first one is the peer evaluation, peer rating scale, assessing the efforts, the interaction with the community. And the students evaluate each other's contribution during community work, encouraging accountability and teamwork. The second method is the community leaders' feedback. Structured feedback from the community leaders on the student interaction is important, as they evaluate the students' effectiveness in health interventions, and this help to assess the real-world applicability of the program. And the third method is the
Before we
supervisory
go to the
checklist.
third,
Yes.
Do you think we seek the help from community health, from community leaders only, without asking the community proper to contribute to the student assessment? Like,
I think we need to train the community leaders and to take feedbacks from them. And this is really helpful because I think the community leaders are the one who's going to provide the
yeah,
students
of course, like we can invite them
Yes.
to when the students are defending their community projects at the school. And but my question is, just the community leaders? What about the community members?
No, the
that we
community
deal with?
members are also very important. We can, it could be in the form of
How?
surveys
How
or
we
something
do
like
that?
that.
Give me an example.
Okay, we can
I
make,
can add,
okay, let's Dr. Amira, please answer.
Okay. Because I have prepared part in the presentation. Yeah, the community member can be like asked regarding their feedback for the service they received or the activities.
Like
so
what?
we can design,
Like what? Give
for
me
example,
an example of a
a
service.
structured, maybe a structured questionnaire directed to the community members themselves regarding their satisfaction.
You know, it's very hard to ask the community members to fill in a questionnaire or something. We
I
want
think an
something
interview,
simpler than this.
I think an interview with them, just asking them, some of the faculty may ask
In what context? In what context?
In what context? Are they happy with the service? Are they maybe?
What kind of service? You mean in the primary health care units or
Yes, in
whatever?
the primary healthcare
But
centers,
what about in the community proper dealing with? Like, I'll give you an example. What about the family visits?
Okay.
When you send your students for, or you assign them for a specific family, don't you ask the family to evaluate the contact with our students when they take history, for instance, from them, or to help them with some health issues, just to get feedback from them, the attitude? You know, every curriculum is made from 3 domains, right?
Yes.
Knowledge, skills, and attitude.
Yes, yes.
So here is the part of the curriculum where you can evaluate the attitude of the students, how he or she deals with the community in a very tender and nice way, you know.
Yes, if they
so you can
respected
get
the
feedback
tradition.
from the family after finishing the family visits of a specific student with a specific family, right? Okay.
Yes. Thank you.
Okay. Can we give you go back now to Amira?
Okay.
Or whoever. Yeah.
Okay, the third tool can be a supervisory checklist. It's a structured checklist, and it can be implemented during the field visits. And what is the benefit or advantages of that tool? It's like it can provide a real-time feedback during the implementation, because like we have the skills included in the checklist, and then we check its implementation if they like grade the patient will, explain history taking, and so on. Method number 4. This is Dr. Marwa slide. Doctor, can you move to the next slide, please? Okay, I will continue till Dr. Marwa brings the next slide. We have a report, either individual report or group report. The students themselves asked to prepare a report about what did they prepare, what they achieved. Preparing a report either through individual or group like enhances accountability and the problem solving with the students, and they are trained on skills of writing reports. Fifth method is short questions. It can be like open-ended question asking them about knowledge, and method focus on knowledge gained mainly, maybe like in observation. In observation, as I mentioned previously, can assess skills and implementation, but for short essay, it can test better knowledge. They can assess maybe through problem or problem-solving skills and the critical thinking and so on. Number 6 is multiple choice questions, and if we are able to design a standardized test covering the knowledge, it can be a valid tool for assessing their knowledge. Next slide, please, Dr. Marwa.
No. Wait. Don't
Okay.
move.
Okay.
And here, I need the attention of everyone in this session. Look at number 5 and number 6, short essay questions and multiple choice questions. We consider community-based education as one of the best integrated curricula. It reached the top level according to the integration scale, level number 11, which is transdisciplinary, right? But when we get to student assessment or evaluation, it doesn't go exactly with the way of education. And we always say that the way of evaluation has to go with the way of education. If we are implementing, for instance, problem-based learning, which is truly integrated, I can't evaluate the students by multiple choice questions and short essays. I have to look for something that suits such integration, which is a very high level, like in community-based education and problem-based learning. So what do you think is a proper tool that reflects integration instead of having short essays and multiple choice questions? Can we go back to the previous slide, please? Yeah. Any raised hands to suggest something? How we can integrate the short essays with the multiple choice questions to come up with a tool that really represent true integration? Any raised hand? Who is saying OSCE? I think we are now in the written exam, right? Short essays and multiple choice. This is a written exam. So if we focus now on the written exam, can we find a tool that integrates short essay questions and multiple choice questions?
I think.
In
Can we use a problem solving questions?
And what do we call that? Give me a term, a medical education jargon. Shayma?
Case-based scenarios?
It's not called the case-based scenario. Case-based scenario in education. Okay, we are now in assessment, in evaluation. So we need an evaluation tool and a medical education term. Have you heard of modified essay questions? See, in modified essay questions, it combines the essay and questions. So it's called modified essay questions, where we are having problems and we ask very specific questions to the stem, to the problem. So we are not in short essay and multiple choice, we can ask about a general disease like diabetes. And we become very satisfied when the student answer general questions about diabetes. In community-based education and problem-based learning and modified essay questions, if the student answer generally, guess what? He will get 0. Because here we are talking about specificity. We need the students to learn how to deal with a specific diabetic patient with certain characteristics. And the questions are very specific to this particular patient or health problem. And this is called MEQ, not MCQs, MEQs, or modified essay questions. Okay? So I expected this group to look for the proper ways of assessment in community-based education, and it's very famous that we use MEQs or modified essay questions. Okay, move on, please.
Okay. Number 7, we can use attendance and logbooks. And like in logbooks, it's a record of students' participations with
What
like
about
as specified.
portfolios? What about portfolios? Isn't it more suitable for community-based education than logbooks?
Both of them can be used.
Of course, but why we chose logbooks and not portfolios? Right? So if they are both, okay, I think portfolios are more relevant to community-based education than logbooks. Okay. Next, please. I mean the oral and yeah.
E-portfolios, sir. Yes, so we can use e-portfolios and we can assess them through the
I'm sorry, I couldn't hear you.
It could be an integration also.
Come closer to the microphone, please.
Yes. Yes, sir. So we could use
So what
e-portfolios
is the difference
so that
between
we will
portfolio
have
and log?
records from the first years to the final years or till wherever this is continuing. So that way we will know the progress and we can integrate it to various other subjects or disciplines also. I think even e-portfolios can be useful.
Yes, of course. Yes, of course. Okay. Okay, go on, please.
And last point is tool is oral and post presentations, like for summarizing the community work, and students can present the findings to the faculty, peers, and community stakeholders. It assesses their communication, presentation skills, and the ability to translate their work into action.
Okay. Thank you so much,
Okay.
Group 4.
Yes,
You were great.
regarding the role of the community and the community representative in facilitating students' learning in community settings. The role of the community and the community representative in facilitating students' learning in community setting is very crucial. For example, community leaders' feedback, they play a very crucial role in supporting the student during their community-based education. They provide accommodation, logistic support, and help the student integrate into the community. This facilitates learning by ensuring that the students engage within real-life health challenges in the community. And this hands-on experience allows the students to develop problem-solving and interpersonal skills. The community leaders help in assessment through assess the student engagement and effectiveness through a structured feedback process. They evaluate the students' understanding of the community health issues, their interaction with the community members, and their overall contribution to the health initiatives. Tutors collect these feedback through group discussions and use it as a part of the student assessment. And as we said before, not only the community leaders, but the community members by interviewing them and asking them about their feedbacks. The second method for assessment through the community is the supervisory checklist. Medical students are posted in villages, primary health units, or rural hospitals. When they work on the real-world health problems, the community representative, such as the health worker, the supervisors, they help the student understand the local healthcare structure, guiding them through problem identification, how to make priorities, and the solution implementation.
Are these pictures made by AI?
Yes. Okay.
Okay.
Okay. The supervisors use a structured checklist to evaluate the students on key competencies such as problem solving, communication, organizational skills. They observe students interacting with patients and delivering the health education, ensuring they use appropriate language, they engage effectively with the community and demonstrate leadership and teamwork, and of course, respecting the traditions of the community they are working in. Regarding the third question, the expected challenges during planning and conduction of a community-based education program in health profession, it could be summarized as the faculty resistance. Some faculty or entire departments may be hesitant to adopt new tools or teaching methods. The community members as an assessor, and the measuring of individual contribution in group work. It is subjectivity of the observer. Also, the high workload required by the faculty. A lot of time is required for field visits and observation, and developing, monitoring, and continuous refinement of the assessment tool is necessary. The theoretical assessment tools like MCQs, essays need to be linked to the real-world problem and case scenarios. And as you said, Professor,
and this
it is
what I just said. If you link it to the real health problems or where the problem, it will become
the
modified
EMQs.
sequence.
Yes, that's what you said before. Thank you. Okay, and the different settings of the field visits may result in non-standardization of the educational assessment. In-depth training of the stakeholders, the peers, the faculty, the program coordinators, the community leaders who are giving the feedback, they need proper training. The genuine student interaction may be masked by the feeling that they are being watched and assessed continuously. So they might not behave on their nature. Okay, and observation and assessment bias is also a challenge in assessment of community-based education. Thank you, and any questions or comments?
Excellent. Group 4. Any questions for Group 4? Any raised hands? Okay.
Thank you.
Thank you very much, Group 4. Group 5. Group 5, you have just 10 minutes. 5 minutes for the presentation and 5 minutes for the questions. Share your screen, please. Group 5.
Okay, it is a beer.
Gamal, could you share your screen?
Okay. Is it a beer?
No. Can anyone from your group help? who else is from your group?
I was intended to share and present.
Okay. It could be run by anyone in the group and you present.
Okay. Anyone can run, please. I think I have some problem.
Okay. Who are the other members in your group? Could you mention their names so we can call them?
Dr.
I am
Shaima
also
Absattar.
trying. I am trying to share also a screen.
Okay. Shaima, please share the presentation. Share your screen with the presentation. And Gamal will present. Did Hikmat
Okay, I will send to her the presentation. Now I send the presentation. I don't know, there is some problem.
Gamal, could you do the presentation without the PowerPoint? Could you start? Because we don't have time. We just have 6 minutes to go.
Okay.
I think someone, yeah, now it appears.
Sorry.
Put it in the
No, it is
slideshow.
group one.
Please.
Group one.
I will share.
Shaima, it's sharing now, I think. Yeah.
Okay, thank you, Summitri.
Put it in the slideshow, please. Okay.
Okay. Community-based education, group 5. Next, please. We have both Shaima and Wissam and Gamal Abdel Qadir. Next, please. What ways might our school be socially responsible and socially responsive and socially accountable for the health of our local communities? Next, please. To be socially responsibility, how to achieve social responsibility, the main intention to produce a good practitioner must be based on identification of society health needs. Followed by social responsiveness, so the competences must be specified and address people health concerns. And finally, social accountability, it needs a partnership mainly with the key stakeholders to make the greatest impact on people well-being. The main stakeholder as policymaker or healthcare organization or maybe health insurance providers.
Okay, Gamal and Group 5, because this is very important, because social accountability is something very important, especially for accreditation. You know, usually we put it as part of our mission, but when the accreditation team comes and inquire about such social accountability and the level of social accountability in your school, nobody knows exactly the difference, especially between being socially responsible and socially responsive. So, in your own words, could you explain to us in very simple words the difference between being socially responsible and socially responsive, you and anyone in your group?
I think on my word is social responsible. It is first come from community. The community health need will, as we can say, ask from the medical school to address its health problem. So the community will reflect into the medical school. But about social responsiveness, it is the action which the medical school will take in the next step to prepare
Okay.
competency
Can
for
I
people.
see if Wissam understand what you are saying? Go ahead, Wissam. Tell me.
Yes, sir, I can give an example by the COVID crisis. Socially responsive is what happened by proper response done by university and hospitals regarding the crisis.
Mm-hmm.
But socially responsible is more extension beyond that. Is by, for example,
So, Wissam. So you consider being socially responsible is a higher level than being responsive?
Yes.
Wrong. According to those who invented or coined the term social accountability from the WHO, it starts by being socially responsible, then responsive in a higher level, then accountable. Okay?
Okay.
And Gamal told us how to be accountable, to go into partnership with the community, which is the highest level. No confusion about it. But usually the confusion, as what happened with you, the difference between being socially responsible, which is the first level, the lowest level, than being responsive. And Gamal tried to explain in simple words the difference. I got it, but I was asking if you already have got it or not, and it seems you didn't get it. So let's ask anyone else first from group 5. If you can explain to us in simple words the difference between being socially responsible and socially responsive, because this is the most important part for group 5. Shayma?
Okay, I think like the social responsibility, this is something regarding to ethics or ethical concept. And the social responsiveness, this is what I do, or my response or my adaptive response to the societal changes.
And what do you mean by ethics?
So what we should do. So what we not forced to do, but what we should do.
Okay. So you say what we should do. This is responsible.
Yes, I think so.
And where is the word responsible then coming? If we are aware what we should do, but we don't do anything till we go to the upper level. So why they call it responsible then?
Actually, I have no idea.
Okay, thank you. Anyone else? See how crucial this part? That's why we will finish the whole session with the inquiry about the difference between being socially responsible and unresponsive. Who else can contribute? We have Noon.
Okay, I think it's the action itself. If it is social responsibility, then we act proactively because before the incident itself, we are trying to prevent something and to educate the community. But when we are speaking about social responsiveness, we are reacting after the incidents. I think, according to linguistic, I just understood it like that. Responsiveness come when something happened, then I'm reacting to that, like Corona, for
So
example.
from where then came the word responsible?
From where
If we
did it
don't
came?
do any act, so where
Ye-
is the benefit either for us as an institution or the community itself? Why
If we're
we
doing
call it responsible then?
if we're doing nothing, then we're
Yeah,
not responsible.
yeah. How how we don't
Yeah.
do nothing and
If
then
we
we
do,
call ourselves responsible then?
we
Isn't
can.
it confusing?
Yeah, it's confusing. If I'm not doing what I should be doing, then I'm not responsible enough for that position or
Okay.
that role, actually.
Okay, but this is not the case actually, because these are WHO terms that it has a meaning, and I will tell you just to Shaima, are you still raising your hand?
Yes, yes. The responsibility is a general term, or the first term in addressing a social relation to the community or social relation to the community. Yes. So it's what is a general term implicitly what is a good practitioner? A good practitioner which is addressing social needs. As
Okay, and how the good practitioner, you know, aware of the needs of the community without reflecting on the curriculum from the real needs of the community. And here comes the responsibility. You know, we are responsible to reflect from the real community health needs on our curriculum so we can educate our students to become responsible practitioners.
yes.
Right? But we don't respond to such needs within the community itself. So if we start to be responsive, then we go a level higher to become socially responsive, right?
Okay. Yes.
And then by time and by community participation and everything, according to the levels of involvement with the community, we can go up to being partners with the community, tete-a-tete, head-to-head with the community. I think we already ran out of time. Unfortunately, we didn't give group 5 the proper time to finish their part of the presentation. But we thank them very much because what we already have explained in relation to the social accountability is very important. We thank group 5, and I thank the 5 groups. You were all brilliant, and I think we all learn it from each other. Any raised questions? I will take just one question just in case you still have questions. No more questions? I'm sure that we're all tired by now because of the brainstorming that was going on for 2 complete hours. Thank you all. You were all great. Can we all open our cameras so we take, Ms. Hikmat will take a group photo? Hikmat, are you ready for the group photo?
Thank you, Dr.
Many.
Wagdi. Nice
Thank
session.
you. Thank you so much. Open your cameras, please. Hikmat, are you here? Hikmat, stop sharing your screen, please, so we can take a group photo.
Recording in progress. Dr. Sumisri?
Hikmat, are you here? Can you take a group photo, please? Everyone, open your cameras, please. If you want to show with us in the group photo. If you don't want to show yourself, that's all right. Hikmat, where are you?
دكتور
هتقدري تاخدي الجروب فوتو ولا لا؟
تمام تمام حاضر.
طيب يلا. Hikmat, if you can, that's all right. If any of the fellows can take the photo also, that's all right. Okay, it seems that there is a technical problem taking the photo. No problem. Thank you all.
I captured the photo. Capture the photo.
You already can. Please send it to us through the group email. Okay?
Thank you.
Yeah.
Okay.
Thank you. Thank you very much.
Thank you,
Okay.
Dr. Wagdi.
Okay. Thank you. Thank you.
Thank you, Doctor.
Bye.
Thank you. Okay. Bye now.
راضي مش راضية تعمل خالص.
خلاص قولي له تكتب بروبلم زي ما هو.
خلاص يا حكمت خلاص. شكرا هم خدوها خلاص هم خدوها.
تمام يا دكتور.
خلاص شكرا.